First Nations in Northern Ontario are reaching out to the province asking for help after declaring a mental health state of emergency. Data from the Sioux Lookout First Nations Health Authority shows that band members go to the emergency room for mental health and addiction issues 14 times more often than the average rate in the province of Ontario. First Nations organizations and the Ontario NDP say that the province needs to recognize colonialism as a social determinant of health to begin to address this disparity. Chief Russell Wesley of Cat Lake First Nation is one of the supporters of this motion, and he joins us from there this morning. Good to have you on the show.
Good morning.
You first became chief of Cat Lake First Nation in the summer of 2020. So what healthcare challenges is your community dealing with right now?
Well, primarily we're experiencing a lot of issues with professional services. Although we have mental health professionals available, there's serious challenges. There's a critical shortage of those mental health professionals in the north. It's similar to this crisis we have with the nurses and the doctors. There has to be a quick and immediate action to help solve this long-standing issues.
You've declared a mental health state of emergency. What does that mean? What does it change in terms of services for people who need to reach out?
Well, we declared a mental health state of mental health. Declaration of mental health emergency because of the numbers of deaths that we were having in the community, whether it was suicide or whether it was natural deaths or whether it was health-related, cancer being one of the major contributors to death. The numbers in the isolated communities are really devastating. In my community, I've had well over 30 deaths since 2020. Wow. And these things are a norm. There's a lot of contributing factors that help increase the death rate. Bill C-52, for example, with Transport Canada, is having an effect on the death rate because with the new Transport Canada rules, a lot of specialist appointments are being missed. And it's helping to contribute to that death rate. People don't think about these things, when they start passing these laws, and oftentimes what happens is the First Nations are not even consulted on these issues. And remote communities is also a difficult work environment, for mental health specialists. Oftentimes we don't even have accommodations. Yeah. And accommodations are, sparse if we do have any. So there's a lot of factors that really contribute to that.
Chief, I wanted to ask you about the provincial government not supporting Ontario NDP leader Saul Makwa's motion, saying that it's going to continue to double down on our efforts to improve healthcare for all Ontarians, including Indigenous partners. So you were at Queen's Park when this motion was introduced last week. What are the next steps then?
Well, for a community like Cat Lake, what we really need is a proactive funding, that's to address cultural revitalization and food sovereignty, as an example. Meaning we need to have the ability to feed ourselves. I was there when Saul put forth the question about colonialism as a social determinant of health. I was there, and I helped support him. But it's no surprise that the government didn't think there was. And I do fully expect them to step up, double down, as they call it. But what really needs to happen is there needs to be a partnership with the federal government as well, and this is what's not happening.
Right.
Although there's been a federal mental health and addictions ministry for the last year or so, there's really been nothing coming out of that ministry, and partly because of colonialism. They don't listen to First Nations and their solutions. There's there's no willingness. I don't know what I can do to fix that, but there needs to be strategic partnerships amongst all partners. That needs to happen.
Chief, I want to thank you for taking time to join us this morning to talk more about the issue, to talk through some solutions. We empathize with what's happening in your community and communities like yours, and we thank you for having the conversation here in your morning.
All right, thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.